So Renee Sinani is the interviewer and Michael Eskandar is the interviewee. How can you demonstrate interpersonal and communication skills in consultation with your clients?
My interpersonal communication skills include active listening, conflict management skills, negotiation skills, problem-solving skills, assertiveness, decision-making skills, and most importantly, the ability to recognize a pattern. I'm also multilingual, speaking 3 languages. These skills can be demonstrated during consultations with clients by actively listening to clients' symptoms and showing them I'm actually listening.
So what are your strengths and your weaknesses, and what are you doing about your weaknesses?
My strengths include my determination, my almost rock-solid willpower, my perseverance, and my biggest strength is I'm highly experienced. I've been through almost everything, so I'm very sympathetic, empathetic. My weaknesses are I sometimes become overly sympathetic or empathetic, and I also sometimes feel the negativity given off by the individuals I interact with on a daily basis. I'm training myself not to be affected by the negativity my friends and family give off, but use this negativity as my strength.
Do you have any talents or hobbies?
My talents include I have a green thumb, I'm very smart, a good cook, and I am a martial artist. My hobbies include weightlifting, martial arts, swimming, and learning something new, and the growing of plants.
Cool. So what are your values that you think are important and what you can bring into your career as a health practitioner?
The values that are important, my values that are important that I can bring with me into my career as a health practitioner include constantly looking at the positive and equity. I believe equity is a very important value as everybody should be entitled to help that best suits their needs. For an example, an individual on a ladder may only need to go up 4 steps, while another may only need to go 1 step due to a height difference. This can be used in the field of complementary medicine by assisting people to the best of my ability, depending on their required needs. For example, if a patient is deaf, I'll be able to type out the message or use sign language. If a patient is disabled or physically impaired in a certain way and required to lose weight, I'll design a workout and diet plan best suited for their individual needs.
So what are your thoughts about the therapeutic relationship?
My thoughts about patient and practitioner relationships is that a practitioner must treat all patients the same, regardless of nationality, age, or gender. Relationships must be kept professional, so the practitioner-patient relationship is not broken. However, most importantly, if a patient opens up to us as a practitioner, we must listen and show them support without breaking our patient-practitioner guidelines.
Good. What do you think self-reflection means, and how would you be able to apply this to complementary medicine?
I believe self-reflection means to reflect on oneself and his or her overall doing, and improve on areas the person finds himself lacking in. In the case of complementary medicine, I will personally, as a practitioner, reflect upon all dealings with clients and how effective my consultations are and see how I can improve these key areas. For example, after a patient consultation, if the patient were to leave disappointed with myself, then I would self-reflect what I have done to cause a disappointment in the patient and seek to improve what caused the disappointment in the patient and hopefully prevent disappointment with other future patients.
Are there any self-care and mindfulness strategies you use to keep yourself grounded?
Yes, there are numerous self-care and mindfulness strategies I practice on a daily basis to keep myself grounded. I meditate a lot, reflecting on what I have done that day, and for the last 5 minutes of my meditation, I clear my mind, go to the gym, and release all my built-up stress. While lifting weights and practicing martial arts, which aids in the clearing of my mind, whilst being a health practitioner, means and methods I intend include a stress ball, a brief meditation between consultations, and I also intend on keeping plants and aromas in the room that are known for their soothing and positive effects.
So why do you want to work in the complementary medicine industry, and where do you see yourself in 15 years?
I want to work in the complementary medicine industry because ever since a young age I have understood the relevance of lifestyle factors on spiritual, physical, and mental health. Most modern doctors, however, ignore this relevance and overly prescribe medications, do not concern themselves with the lifestyle of the patient. with the overprescription of medication causing immune system failure, organ failure, let alone the numerous side effects of most medication, the world needs more complementary medicine practitioners who understand the relevance of lifestyle changes, how the well-being of the whole body is intertwined. I see myself in the next 15 years hopefully running and owning my own surgery, as well as becoming a reputable, important figure in the industry. I'll also be doing research in herbal cures for common diseases, and most importantly, giving other practitioners and naturopaths the opportunity to get started in the industry and help them grow.